Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest is Shawn Fichter. He's CEO and head of product at Legacy Data Access. Welcome, Shawn.
Thank you very much, John. Pleasure to be here. Thanks for taking the time.
Yeah, definitely. A busy conference here at the AHIMA annual conference, and I appreciate you taking the time to come and share your insights and perspectives. Before we dive into today's topic, why don't you tell us a little bit about yourself and Legacy Data Access?
Sounds great. So Shawn Fichter, head of product and the CEO for Legacy Data Access, a company that's reimagining what it is to archive and thinking about what we can do with this information, even if it's retired or it's coming out of an outdated system and you've moved on.
Interesting. So what are some of the big trends that you see happening in the market, and how are they impacting healthcare organizations today?
A lot of cost, obviously. So much restriction on the ability to provide care at a lower cost point. Coming out of COVID, we saw a lot of that, and it's still the ripple effect today. So that's one of the primary constraints. I also see the ability to access information, especially here at AHIMA, that's really still a constraint. We're not sure where all the information is. So one of the key elements that we're working on and focusing on is making sure that we're giving the information to the right user at the right point in time.
Interesting. I've heard a lot about the cost pressures. I mean, you hear that everywhere, right? We don't have enough. It's interesting, the other point, what do you think are the risks that these trends are creating for the healthcare organizations?
Cost and that pressure is creating silos and little pockets of, hey, we've got a really, really great fix for this one specific thing, and then another great fix for this one specific thing. But now trying to connect those and the overall element of providing care, that's where we're seeing that cost constraint is getting you down into very, very pointed solutions. And now I see some of the larger systems thinking about platform approaches, thinking about how can we solve this solution so it really grows with us, and it's not just a point in time fix for today.
Interesting. So describe that more. Is the reason they're point solutions because they only have budget to do like a small thing, or is it because they have so many systems that they've accrued over time? Or talk more about that.
Sure. It kind of depends on who you're talking to. So your regional players, those hospitals that are independent and not part of a larger healthcare system, they're dealing with cost everywhere around. So they really have to maintain that budget line. But when you talk to the larger systems that have 20, 30 entities, now they're trying to figure out what's the right platform play? How do we make sure that this is consistent and that it's not creating these data pockets and these silos of information and solutions?
Interesting. I want to talk about M&A in a minute, which I think creates a lot of those silos as well. But before we go there, you work a lot with legacy applications. Right. What are some of the problems that you see legacy applications causing? To me, it sounds like more silos, but what's your perspective?
That is, it's a great point, and they are creating silos, and they're the forgotten child. They're off there, they're not accessed that often anymore, and that's one of the prime vectors for threat attacks and security. So you're creating a pretty large security envelope that you can really, the risk profile is just unnecessary. Taking care of those systems, getting that data off and under management instead of just letting it creep out there, that's a major, major concern right now.
Is that the thing people don't want to admit? That it's not under management?
Yeah, it depends on who you talk to, right? So if you talk to a CISO, obviously they're not going to think about the threat and the vectors and maybe exposure, but we see these attacks every single year. Millions and millions of records are being released, and it's not intentional. So I think it might be a little of that, but overall, the goal is making sure that we've got the right data protected and that it's usable. Locking it up, sure, we can put all the security controls around it, but then you can't use it, or it's very difficult to use. You have to unlock it for that point in time case or that the legal request or whatever it might be. So it's a balancing act between the two, but that's where I think we need to start to think about the information that the systems hold and not just look at the applications. It's what we need to use them for.
Yeah, and I think every AI application wants as much data as possible.
They sure do.
And if it's locked up in a PDF, they're probably not going to use it.
Exactly, yep.
That's interesting. So, as I mentioned, M&A is part of this challenge.
Right.
We see so much M&A happening. I mean, we publish it all day, every day, and it's never ending. Talk about how M&A is impacting these duplicate applications, even orphan applications, like you said, you talked about a little bit. What can be done about those?
I think it's more the approach that we're taking right now in M&A. We come through one cycle where we complete the transaction. So now everyone's working off of the same paper and the lawyers and the bankers are done. But then you think about the applications and the systems that we're using to create care or to provide care. And now you just created multiple silos. So instead of the approach that we're seeing, and where I think the archivist can really play a more prominent role, is working in that M&A timeline to help it along. Today, we come back around. We complete the transaction, we're on to the new system, and then we look back and say, what do we need to do now? What about the app rationalization? What about the retirement game plan? If we parallel these, and which is what we're doing with our clients today, it helps them move quicker, and now you're providing care more efficiently and more effectively as you go through the transaction.
That's interesting. I think you're right that like in an M&A transaction, how often do they talk about the application rationalization? I think it's mostly a financial money.
Right, it absolutely.
That's interesting. That's a shift in mindset though. I like that.
We're seeing that actual shift, and those that are taking advantage of it, they're shortening their overall timelines.
Oh, okay.
So now we're back up and running, and we're providing that care, and your practitioners, your physicians, they're credentialed a little bit quicker. You've got a truly connected patient record, and you're not hunting for the information when that patient walks in the door.
And then you're ready to acquire the next one.
Yeah, exactly. That's right.
Probably what will happen.
That's right.
Yeah, so I mean, if you were talking to a healthcare leader today, like how should these healthcare organizations be approaching legacy applications and health data archiving in general? I think for many it's an afterthought, being frank, like how should they be thinking about it, and and why is it so important?
Yeah, it's a great question. I'm challenging the CIOs and the C-suites that I work with on thinking about the information and the communities that the information supports. So your HIM teams, your release of information teams, your analytics, your research, your genome, your grant managers, don't talk about the systems or the application. Those applications constantly change. There will be a new Epic somewhere down the road. So we'll have a new EMR, but what about the information, and what are we doing with it? How can we make it purposeful once again instead of locked up?
Interesting. And what are some of the key elements that should be included in a strategy that's thorough, that's well done, if they're doing health data archiving?
Yeah, we're talking tomorrow about the combination of different practices and policies. GRC is one. Okay. So governance, risks, and compliance. We know that HIPAA, we have retention periods for PHI and PII, but how are we connecting this across the organization, and what are we doing overall with the system management? Looking at it from a risk standpoint, even underwriting into some of the policies, healthcare systems hold very, very valuable information. Those policies are very expensive. So how can we reduce that footprint so that you're only securing absolutely what you need, and give a little bit of separation here? Makes it a lot harder to track through. And if in the event that you are ransomed or that you do have a cyber attack, you limited that exposure. Sure. It's only what is absolutely necessary for you to provide care. So I look at it that hospitals are there to provide care, not necessarily to be IT companies. So let me help you provide the care. I'll take care of the information and the data.
Interesting. It seems like that's one of the challenges as I hear you talking about it. It's like, okay, well, the CISO is going to benefit because there's a reduced security footprint. The CIO is going to benefit because, the cost of all those old applications and having to manage them, and the expertise to manage them and access them. The HIM professional is going to benefit because they have easier access when they do the release of information. And so it's like everyone benefits, but no one owns it. Is that kind of what you see, or how do you see it playing out in organizations that are more proactive?
Yeah. Most of the time, IT owns this concept of archiving and data management, and IT is a cost center in healthcare systems, right? So they're looking at providing that service at the lowest cost possible, which I agree with. However, we're not really thinking about the upstream benefits, the secondary uses. So when you look at research teams, the analytics teams, the HIM, the ROI reporting, there's some clients that staff 80, 90 people just to perform one function, when it's really the technology solution could be a little more optimized. You don't need the staff in order to do this kind of work. So applying just staff to some of these challenges, I think that's a approach that should be challenged and continually challenged. So there isn't one single owner, but there needs to be a committee approach to where does this information need to go. There are just that many communities that a record serves.
I want to hear more about that. You've mentioned a couple of times, okay, it's one thing for compliance, it's one thing for security. We have to do those, of course. But how do you approach making sure that the data in the health data archive is actually useful and is available to those that need it? Right,
the front end, the actual access, how are you getting to that information, and why are you going for the archive? Why are you even accessing the archive? understanding those use cases, now I'm talking to specifically practitioners and clinicians. And then in other instances, I'm talking to HIM managers. I'm talking to research analysts and the life sciences team of the hospital. Knowing how they think and how they view access into the information, now I can build the correct pathways via the application front ends, being the web interfaces and the ability to get to this information as readily as possible.
Interesting. And how about integration? How do you approach it from an integration standpoint?
It's curious. Integration also opens the door for more vectors to get into that info. So we have to balance that. Everybody asks for the data all the time. That's great, but we really want to vet and validate what is it that you need, when do you need it, and for what purposes. So opening the door up is fine. We do that many times, but we also want to make sure that we have a good audit control log. What are you accessing? What are you looking for? And then where are you taking that information? So it's a user community balance between the risk profile and the ease of use. And that's a constant, that's always going to be a challenge for us.
Yeah.
So we'll always have to probably say no to a few, or maybe not exactly how they want it. But ultimately the goal is make the job easier. You're there to provide care. So let's not get in the way. And we're technology solutionists, so let's make the technology work for us.
Well, and it's probably application by application, right?
It is. It is. They all have their nuances.
Yeah, that's interesting. What do you see next for health data archiving?
I see empowering care. I see care enablement, a new user community that's now, I'm seeing additional interest in what is health data archiving are the case managers.
Okay.
And the optimization around, is this the right therapy for this type of condition or disease state? What does the information tell us? How can we learn from what we've done in the past, analyze that, and maybe tweak a little bit the different care plans and the therapies that we're using today in order to improve the overall health, the overall case itself, and get that person in and out of that condition or that state. So yesterday's got a lot to teach us. That's what we use here at LDA. And that's where I really think the future of archiving is. It's not about the systems anymore. It's about the information. And now what can we do with this information to benefit everyone overall?
Yeah, that's really interesting. As I kind of look forward, it's like AI solutions are going to replace old solutions.
Right.
And they're also going to want more access to the data.
Right.
And in both cases, you need a high quality strategy to be able to access that data and then to deal with the old systems that the AI solutions are replacing.
Absolutely. AI wants to eat up as much data as possible. Archivists are in that space, so let's be smart about it. Let's ready the information so it can be as effective as possible.
Yeah. Shawn, I appreciate you taking time out of the busy schedule here at the AHIMA annual conference, being able to sit down and talk to us about an important topic that can save people money, which is important right now, and provide better access to the data for their patients. So thanks so much.
Thank you.
Thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Shawn.
Thank you very much, John.